Hi, my name is Lucy Shah, and the topic that I chose was multistate outbreak of Salmonella Stanley infections linked to raw cashew cheese. The first step in the analysis for this public health case is the background. Salmonella is a bacterium that occurs mainly in the intestines and causes food poisoning. Most people infected with Salmonella bacteria develop diarrhea, fever, and abdominal cramps 12 to 72 hours after the infection. The illness usually lasts 4 to 7 days, and most people recover without treatment. In this case, a total of 17 people were affected by this outbreak, with 15 people in California, 1 person in Nevada, and 1 person in Wyoming. 3 people were hospitalized, and thankfully there were no deaths. The product that was recalled had an expiration date on April 19, 2014. The second step is the current situation. The strength is that the California Department of Public Health isolated the outbreak strain of Salmonella Stanley from an open package of the Cultured Kitchen brand smoked cheddar cashew cheese. Public health investigators are using DNA fingerprints of Salmonella obtained through diagnostic testings to identify cases of illnesses that may be part of this outbreak. The weakness is that this strain of Salmonella Stanley is rare in the PulseNet database and has only been seen 20 times prior to this outbreak. The opportunity is that CDC published the outbreak on their website, easily accessible to many, and the case was also published in multiple other sources such as the Food Safety magazine, making people aware of this issue. The company had also willingly recalled their products at the time of the outbreak, and the consumers can return the products to their place of purchase for a full refund. The threat is that this product has a long shelf life and contaminated products may still be in people's homes. Step 3 involves prioritizing core issues. Salmonella can be found in many foods, including vegetables, eggs, chicken, pork, fruits, and even processed foods. Contaminated foods usually look and smell normal. The outbreak was caused by the consumption of raw cashew cheese. I think that regulation for food companies should be prioritized since washing the fruits and vegetables at home will not prevent salmonella. Food companies should test their food products before distribution. In step 4, the alternatives are analyzed. The health belief model can be used. Salmonella can cause major health concerns and lead to death. Consumers cannot prevent this infection, only the food companies can. The first approach would be to enforce mandatory salmonella checks on all food items before being shipped for consumption. Another approach would be to have regulated inspections to ensure all food companies are up to standards and handle the food items with proper care. Step 5 talks about the recommendations. The first recommendation is to always wash your hands after contact with animals, using the toilet, changing diapers, or cleaning a toilet. The second recommendation would be to refrigerate or freeze perishables, prepared foods, and leftovers within 2 hours, or 1 hour if the temperature outside is greater than 90 degrees Fahrenheit. The third recommendation is that if you see these symptoms of salmonella mentioned previously, make sure to go see a doctor immediately. Step 6 is the action plan. A report of salmonella cases should be conducted and researched to see how many people were affected in the past 5 years. The FDA should enforce all food companies to test for salmonella before releasing the products to the public within the next year. There should also be at least 2 checks per year for every food company to ensure their hygiene and food handling is up to standards. Another report should be conducted 5 years later to see if there has indeed been a reduction in salmonella cases. The last and final step is my opinion. Many times in the past, I would eat food with my hands directly after I pet my dog or even other pets. I would also wait a couple of hours for food to get cold before I decide to put them in the refrigerator. However, after learning about some ways that salmonella can develop, I know I should always wash my hands before I eat and ensure that I always refrigerate food shortly after I finish eating them to prevent any bacteria from forming. Thank you.